right, today we are talking about Medicare. We are talking about the Inflation Reduction Act and how that is also putting things into practice with Medicare and how that's going to save some money. With us today, we have Catherine Sevier from AARP and Steve Edmonds from Alliance Insurance Services. I'm reading your text questions as I'm doing their introduction. All right, so this person is just talking about regular health care, not Medicare. They're saying this law is supposed to take effect 24 to 29. How in the world is this going to help citizens who work now for a living? What can you say about the Affordable Care Act and the Medicare medical plans that are available?
Well, the Affordable Care Act, that helps people in a lot of ways because, if people qualify and it's based on income. So when you're applying for the ACA plans, your income is one of the criteria they use. But if you fall in certain ranges, the government gives a lot of help to people in that area. So that's one thing that reduces the price that you pay or the premium that you pay per month on your health insurance. So, if you're working through a company, through a group plan, these things that we're talking about with these laws that have been passed, I don't think are going to have a lot of impact there. So yeah, I think group plans are probably not going to be impacted a lot by this new legislation that's passed.
Right. It's basically for those on the ACA or on Medicare for getting those
Correct.
costs down. All right. This person's asking, what about blood thinner medication? Mine costs like $88 a month. Catherine, do you know about that?
So a lot of the blood thinner medicines that are so expensive, the new name brand ones, are in that list of 100 drugs that Medicare is going to consider for negotiation. And I wouldn't be at all surprised if at least one of those are in that top 10 that we were talking about for 2024.
Okay.
So we'll see where that lands, but they are pricey.
They are pricey for sure. All right, so Steve, let's talk about this because this person says, do any of the Medicare parts cover dental expenses?
Traditional Medicare never covers dental unless it's some sort of emergency dental where you've been injured, maybe like in a car accident or something of that nature. There may be some coverage, but just for preventative dental and regular dental coverage, no. However, we do have Medicare plans now that are called Part C, Medicare Advantage plans. And a lot of the Medicare Advantage plans do have coverage for both dental, vision, and even hearing, and even over-the-counter drug coverage where you get a certain allowance per quarter for that. So a lot of these Medicare Advantage plans have incorporated a lot of these good coverages that people use every day. So they're worth looking at for sure. But traditional Medicare does not cover dental, but a Medicare Advantage plan, a lot of those do cover dental.
Okay. All right, let's talk about the timeline, Catherine. And we've got a graphic so that, as she's explaining the timeline of when you need to sign up for Medicare, and I meant to say 65, I said 62, but 65 is the date. But you have a certain amount of time to sign up. So, Catherine, let's talk about it.
So, when you approach your 65th birthday, your priority needs to be to go online and go to Medicare.gov and sign up for Medicare. And that means all parts of Medicare, Part A and Part B, because without that, if you don't sign up, Part A occurs automatically for all of us. That's the hospital part. Part B is the part that Steve talked about with all of the outpatient visits and radiology and all that stuff. 3 months before your 65th birthday to 3 months after, so a 7-month window, you need to sign up. If you're still employed and you have an employer who meets the standard, you can waive Part B until you're ready to retire or no longer insured by your employer, but you must sign up. If you don't, you will pay a big penalty.
Yeah, and we see that penalty down at the bottom of that. Yeah, that penalty at the bottom of the graphic. You're going to face a 10% penalty, every single year for the rest of your life if you miss the window to sign up for Medicare. Again, that's 3 months before your birthday, the month of your birthday, 3 months afterwards. And so that is a key fact. All right, so folks, something else that we want to make sure that you heard her say, you might have been reading the graphic, you have to sign up for all parts. That includes Part B. Even if you are working and you have your own health insurance, then you can defer Part B, but you have to sign up for it first. Otherwise, you're going to pay that penalty. All right, we're going to continue to answer your text questions. We got one more segment coming up after this.